Thank you, Hansel, and thanks for the opportunity to share with you. I'm going to speak about the power of partnership today to reduce infant deaths by 48% in Botswana. So let's start with the problem, and we're going to start our story in Botswana. You can see where Botswana is on the map, a country about the size of Texas or France. And we're going to start with Henry, and you can see a picture of Henry leaning over a child there. Henry was a global health fellow who joined us at CHOP and at Botswana UPenn in August of 2009. He started working in Botswana's second largest town, Francistown, and what he noticed is that he was seeing a lot of very sick children, and you can see a picture there of one of the kids that Henry would have seen. These children were coming in with severe gastroenteritis, vomiting and diarrhea, and despite what Henry and all the colleagues were doing in Botswana, a number of these kids sadly were dying. So much so that in the gastroenteritis season, each year, there'd be at least one child a day that would die. And Henry said, what on earth is going on here? Why are these kids dying? What's the cause? And so with his mentors in Botswana and back here at Penn and CHOP, Henry took on a research project in 2010 in his second year of fellowship. And he looked at all these children who were being admitted in Francistown and in Gaborone, and he looked at the causes of gastroenteritis. And what he discovered, you can see there, maybe not surprising to us now, 15, 16 years later, but 78% of the sickest children who were coming in with gastroenteritis had rotavirus. This at the time was new news for Botswana. So what was the solution? Well, fortunately, as part of Henry's mentoring team, he worked with Dr. Lueto Majani, pictured, and Dr. Margaret Mokomane. Dr. Lueto Majani is a famous pediatrician in Botswana who'd worked in the Ministry of Health and was working at the University of Botswana at the time. And Dr. Margaret Mokomane was the leader of the National Health Lab. And so what Henry did with his mentors and with Dr. Majani and Dr. Mokomane is he met with the Ministry of Health. And wonderfully, thanks to the influence, particularly of Dr. Majani and Dr. Mokomane, the Ministry of Health listened, said this is an issue, we need to deal with it, and they brought forward the rollout of the rotavirus vaccine in Botswana. And this was rolled out in July of 2012, making Botswana one of the first countries in Africa to roll out rotavirus vaccine. So what was the impact? Well, Leslie Anane, pictured here, a CHOP ID fellow with a strong interest in global health, worked with the CDC and colleagues at Botswana, Penn, and CHOP to work this out. And you can see in the graphic, which is shown from her paper that was published in Clinical Infectious Diseases, the impact. On the y-axis, we have number of deaths in a year. And then on the x-axis, we have the pre-rotavirus season in black. And you can see there that each year, for the 3 years that were looked at, 40 children were dying at the 4 hospitals that Leslie looked at. And then in the first year post-rotavirus vaccine, that the death rate dropped by 53% in these 4 hospitals, and the second year by 43%. So an incredible result. And the overall summary of her paper was that post-rotavirus vaccine, there was a 48% reduction in rotavirus deaths in children under a year. This represents 20% of the population of Botswana, so we can times the numbers by 5 to get a country impact. And this has led to the WHO, amongst other papers, to encourage rotavirus rollout across the African continent. So in summary, partnerships have power. But you can see at the bottom of the slide who is involved with this: the Botswana UPenn Partnership, the University of Botswana, the Ministry of Health of Botswana, McMaster, who did the testing, the CDC, who helped with epidemiology, and CHOP. And so my message is simple. If we've got the right people in the room, powerful partnerships can save lives. Thank you.